Welcome to South Georgia Career Center's Medical Assistant class, Chapter 10, Urinary System. Contents in this chapter are: organs of the urinary system, kidneys, ureters, urinary bladder, urethra, urethra sphincter, nephrons, glomerulus, afferent arterioles, Bowman's capsule, proximal convoluted tubule, distal convoluted tubule. Functions of the urinary system: regulation of plasma ionic compositions, regulation of plasma osmolarity, removal of metabolic waste and other substances from the plasma, secretion of hormones, formation of urine, filtration, reabsorption, water, glucose, sodium ions, secretion, water-salt balance, reabsorption of water, reabsorption of salt, atrial natriuretic hormone, hypernatremia, diuretics. Common medical conditions: kidney infection, kidney disease, glomerular disease, kidney stones, urinary retention, urinary incontinence, cystitis, fallen bladder. Organs of the urinary system. The urinary system is defined as the group of organs that are responsible for filtering out excess fluid and substances from the bloodstream. These excess fluids as well as other substances are filtered out in the form of urine. Urine is a liquid that is produced by the kidneys, collected in the bladder, and then discharged through the urethra, the tube that connects the urinary bladder to the genitals to remove excess fluids. Urine is also used to withdraw excess vitamins, minerals, and/or blood cells from the body. Organs of the urinary system are the kidneys, main organs of the urinary system, the bladder, ureters, and the urethra, although the urinary systems work with other body systems to maintain internal stability. Kidney anatomy. The body consists of two kidneys that are located on each side of the spine, high in the abdominal cavity, and somewhat protected by the lower ribs. The kidney's long axes are even with the body, but the kidney's upper end is slightly tilted toward the backbone. The hilus, located in the midsection of the medial concave border, is the entry and exit point of the renal veins and arteries, nerves, lymphatic vessels, and the upper end of the ureters. Kidneys are reddish-brown in color, resemble the shape of a bin and have a size of about 4 to 5 inches. The kidneys consist of three main areas: the renal cortex, the renal medulla, and the renal pelvis. Renal cortex. The outer portion of the kidneys is between the renal capsule, fibrous layer surrounding the kidney, and the renal medulla, innermost part of the kidneys or center. Renal medulla. The center of the kidneys is where blood enters through the renal artery. The renal medulla holds the structures of nephrons, which are maintaining the water-salt balance of the blood. Renal pelvis. The upper end of the ureter, a tube through which urine flow from the kidneys to the urinary bladder, takes place. Renal artery. These arteries arise from the abdominal aorta, giving off small branches to the adrenal gland and ureter, then branches into anterior and posterior divisions, ureters. The ureters are two narrow tubes that channel urine from the kidneys to the bladder. These tubes, ureters, emerge from the kidneys, one ureter from each kidney, move down behind the abdominal cavity, and open the bladder. The strong walls of the ureters move the urine into the bladder. Once urine enters the bladder, small folds within the bladder mucosa prevent the backflow of urine. At times the ureters can become infected, causing urinary tract infections. Urinary bladder. The urinary bladder is the organ that temporarily stores urine from the kidneys. It is a muscular, hollow, and extensible organ that is located in the pelvis. It is connected to the kidneys through the ureters, tube-like structures, and can hold about 15 ounces of urine. Once filled with urine, so-called stretch receptors send impulses to the spinal cord, which sends back a reflex nerve impulse to the sphincter, a muscular valve at the bladder neck. As urination starts, The sphincter muscles relax, therefore allowing urine to flow into the urethra and out of the body, urethra. This is the last part of the urinary system, as it is the part that removes urine from the body. In men and women, the urethra is different in length. In women, it is about 1.5 inches long, but in men, it measures between 6 to 8 inches in length. This difference in length is considered to be a reason why women are more susceptible to bladder infections than men, as bacteria travels a much shorter distance. In women, the urethra opens in the vulva, between the clitoris and the vaginal opening. In men, the urethra opens at the end of the penis head, urethra sphincter. The sphincters are muscles that are used to control urine flow from the bladder. Sphincter muscles surround the urethra. As these muscles contract, the urethra is closed. It is divided into two areas of muscle. Internal sphincter, located at the neck of the bladder. External sphincter. Men have much stronger sphincter muscles which allow for more urine to be stored, nephrons. Nephrons are structural and functional components of the kidneys. A nephron is actually the structure responsible for the production of urine in the process of waste removal and excess substances from the blood. Nephrons remove waste from the body, manage blood pressure and volume, control levels of electrolytes and metabolites, and manage the blood pH. The functions of nephrons are essential to life and are regulated by the endocrine system by hormones, as aldosterone, antidiuretic hormone, and parathyroid hormone. Each nephron has its own blood supply from two capillary regions from the renal artery and is made of an initial filtering part, renal corpuscle, and a tubule, renal tubule, specialized for reabsorption and secretion. The renal corpuscle filters out large solutes, the substance dissolved in a solvent to form a solution, from the blood and then transferring small solutes and water to the renal tubule for adjustment, glomerulus. A capillary's tuft, located within a Bowman's capsule, cup-shaped structure, located around the glomerulus of nephrons, at the end of the renal tubule. It filters waste out the blood and initiates the formation of urine. The excess blood that is not filtered into the glomerulus passes into the efferent arteriole and then moves into the vasa recta, collecting capillaries connected with convoluted tubules, where the reabsorbed substances enter as well. Connecting with efferent venules from other nephrons into the renal vein, it rejoins into the main bloodstream, afferent arterioles. The afferent arteriole is a branch of an interlobular artery going to the renal glomerulus, to supply nephrons. Later, the afferent arterioles will branch off to the capillaries of the glomerulus. Afferent arterioles are an important part of regulating blood pressure. Efferent arterioles. The efferent arteriole is a branch of an interlobular artery that is arising from the renal glomerulus and breaking up into capillaries to supply renal tubules. Efferent arterioles are an important part of maintaining the glomerular filtration rate in blood pressure. Bowman's capsule. This capsule, cup-like sac, that surrounds the glomerulus, is made of visceral, simple inner squamous cells, and parietal, simple outer squamous cells, layers. The outside of the capsule consists of two poles, the vascular pole, side with the afferent and deferent arteriole, and the urinary pole, side with the proximal convoluted tubule. Inside the capsule, outside to inside, the layers are: the parietal layer. Single layer of simple squamous epithelium. Does not function in regards to filtration. The Bowman's space. Between visceral and parietal layer, where filtrate enters. The visceral layer. Located above the glomerular basement membrane. The filtration barrier. Made of the fenestrated endothelium of the glomerular capillaries, fused basal lamina, and the endothelial cells and podocytes. Allows the passage of ions, water, and small molecules from the bloodstream to enter the Bowman's space. Proximal convoluted tubule. This tube is the part of the duct system of nephrons that leads from the Bowman's capsule to the loop of Henle. A very distinctive characteristic of this tube is the brushed border, microvilli covered surface. The PCT can be separated into two parts, the pars convoluta and the pars recta. Pars convoluta, defined as the initial convoluted portion, and confined to the renal cortex. Pars recta, defined as the following straight portion, descending into the outer medulla. The PCT is responsible for regulating the pH of filtrate through the exchange of hydrogen ions in the interstitium for bicarbonate ions in the filtrate. It is also responsible for the secretion of organic acids, like creatinine or other bases, into the filtrate. Distal convoluted tubule. This tube is part of the nephrons, located between the loop of Henle and the collecting duct system, and is similar in structure and function to the PCT. The cells that are lining the DCT have many mitochondria which enable active transport by the energy supplied, with the main ion transport being regulated by the endocrine system. If the parathyroid hormone is present, the DCT will reabsorb more water and excrete more phosphate. If aldosterone is present, the DCT will reabsorb more sodium and excrete more potassium. Causing the excretion of more sodium is the 8-real natriuretic peptide. In order to regulate pH, the DCT also secretes hydrogen and ammonium, functions of the urinary system. A major function of the urinary system is the process of eliminating waste products of the metabolism and other materials, also called excretion. By regulating the amount of water that is excreted in the urine, the urinary system can maintain an appropriate amount of fluid volume. The urinary system also regulates the concentration of certain electrolytes that are in body fluids and the maintenance of a normal pH of the blood. There are several organs that carry out excretion, with the kidneys being the most important one of the excretory organs. The kidney's primary function is the maintenance of homeostasis, stable internal environment, in order to ensure optimal cell and tissue metabolism. Kidneys do this by separating mineral salts, toxins, urea, and other waste products from the blood. Kidneys also conserve water, salts, and electrolytes. In order to maintain life, at least one kidney has to function properly. There are 4 important roles of the kidneys. These roles are: regulation of plasma ionic compositions, regulation of plasma osmolarity, removal of metabolic waste and other substances from the plasma, secretion of hormones, regulation of plasma ionic composition. Ions include potassium, magnesium, sodium, chloride, calcium, bicarbonate, and phosphates. These compositions are regulated by the amount excreted by the kidneys. Regulation of plasma osmolarity. Osmolarity is regulated by the kidneys as they have direct control over how many ions and how much water is excreted. Removal of metabolic waste and other substances from the plasma. While the liver breaks down amino acids, it releases ammonia, with the liver then combines that ammonia with carbon dioxide and creates urea, primary nitrogenous end product of metabolism, which is less toxic. Ammonia, uric acid, from the breakdown of nucleotides, and creatinine, from the metabolic breakdown of creatine phosphate, a high-energy phosphate in muscles, can also be excreted, although in small amounts. Too much uric acid in the blood can build up and form crystals that can accumulate in the joints and cause gout. Secretion of hormones. Kidneys are assisted the endocrine system when releasing hormones. Kidneys release renin, and renin leads to the secretion of aldosterone, which is then released from the adrenal cortex. Aldosterone helps the kidneys to reabsorb sodium ions. If the blood doesn't have the capacity to carry oxygen, the kidneys also secrete erythropoietin, which stimulates the production of red blood cells, formation of urine. The formation of urine happens in 3 steps: filtration, reabsorption, and secretion. Filtration. Filtration, the first step in urine formation, is the process that occurs continually in the renal corpuscles. As the blood passes through the glomerulus, much of the fluid in the blood, which contains useful chemicals as well as dissolved waste materials, wash out the blood. It is then filtered as it moves into the Bowman's capsule. This is called glomerular filtration. The waste products, salt, water, glucose as well as other chemicals that were filtered out of the blood are known as glomerular filtrate, which consists mainly of excess salt, water, glucose, and waste products of the body known as urea. Urea is produced by the body to remove ammonia, which is formed in the liver from amino acids. Urea is the most abundant waste product that has to be excreted by the kidneys. Reabsorption. Reabsorption is defined as the movement of molecules and ions from the renal tubules back into the blood capillaries. The substances that are reabsorbed are glucose, water, salt, other nutrients, and other ions. The process of reabsorption begins in the PCT, proximal convoluted tubules, continues in the loop of Henle, the DCT, and collects tubules. There are three main substances that are reabsorbed into the bloodstream: water, glucose, and sodium ions. Water. Large amounts of water are reabsorbed back into the bloodstream from the PCT. This happens because the physical forces acting on the water in these tubules push most of the water back into blood capillaries. The process of water leaving the blood by glomerular filtration and returning to the bloodstream from the PCT is called passive reabsorption. Glucose. Glucose, blood sugar, is all reabsorbed back in the bloodstream from the PCT. The blood sugar is moved out of the tubules and into the peritubular capillary blood, with none of it being wasted or lost through the excretion of urine. But even with the kidneys working efficiently, the nephrons can reabsorb only so much sugar and water, and these limits are shown in cases of diabetes mellitus. Diabetes mellitus is a disease that causes blood sugar to rise above normal blood sugar levels. Sodium ions. Sodium ions as well as other ions are partially reabsorbed back into the blood from the renal tubules. The amount of sodium ions that are reabsorbed can vary from time to time, and mainly depends on how much salt is taken in through the diet. As a person takes in more sodium through the diet, the kidneys will decrease the sodium amount that is being reabsorbed back into the blood. Secretion. The third step in the formation of urine is secretion. It is the process in which substances move from the blood in the capillaries into the distal and collect tubules around these. It is basically the reverse process of reabsorption. Reabsorption moves substances out the tubules into the blood, and secretion moves substances out of the blood into the tubules where they mix with water as well as other wastes and then convert into the urine. These substances can either be secreted through an active transport mechanism or as a result of diffusion across the membrane. The substances that are secreted are potassium ions, hydrogen ions, ammonia, and certain drugs. Urine is basically the collection of substances that have not been reabsorbed during glomerular filtration or tubular reabsorption. Water-salt balance. Kidneys are responsible for maintaining the water-salt balance of the blood. The kidneys also maintain blood pressure and blood volume. This balance can simply be changed by factors such as dehydration, ingesting water, blood loss, and salt ingestion. Reabsorption of water. The antidiuretic hormone, ADH, is responsible for the direct control of water excretion in the kidneys. ADH is released by the posterior lobe of the pituitary gland and causes the insertion of water channels into the membranes of the cells that are lining the collecting ducts, therefore allowing water reabsorption to take place. If ADH was not present, little water would be reabsorbed into the collecting ducts and thinner urine would be excreted as a result. Several factors can cause changes to the secretion of ADH. For example, if blood plasma gets too concentrated, special receptors in the hypothalamus release ADH. When blood pressure falls, stretch receptors in the aorta and carotid arteries will stimulate ADH secretion in order to increase blood volume. Reabsorption of salt. Kidneys also regulate the salt balance in blood by controlling the excretion and reabsorption of certain ions. ADH is an important part of the increase of water reabsorption and therefore helps to weaken bodily fluids. Kidneys have a regulated mechanism for reabsorbing sodium in the distal nephron, controlled by aldosterone, which promotes the excretion of potassium ions and reabsorption of sodium ions. The release of aldosterone is started by the kidneys. Following the reabsorption of sodium ions and the reabsorption of water, which causes an increase in blood pressure and blood volume, atrial natriuretic hormone. Atrial natriuretic hormone, ANH, is released by the atria of the heart when cardiac cells are stretched due to higher blood volume and prevents the secretion of renin by the juxtaglomerular apparatus as well as the aldosterone by the adrenal cortex. This then promotes excretion of sodium. If sodium is excreted, so is water, which then causes blood volume and blood pressure to decrease. Hypernatremia. Hypernatremia is the increase in plasma sodium levels above normal. Sodium levels play a major part in osmolarity regulation. The electrochemical gradient for sodium across the plasma membrane for excitable cells is critical for life. Increased blood pressure and water retention are generally signs of hypernatremia. If the plasma sodium levels are below the normal levels, it is called hyponatremia. Signs for hyponatremia are hypotension and low plasma volume. Diuretics. Diuretics, also called water pills, are medication used to elevate the rate of bodily urine excretion. Diuretics also decrease the volume of ECF, extracellular fluid, and are mainly used to produce a negative balance of ECF. Diuretics are used to treat a variety of conditions including heart failure, hypertension, liver cirrhosis, and certain kidney diseases, as diuretics relieve the symptoms of these conditions by causing sodium and water loss through urine. There are also diuretics, such as acetazolamide, that help in making urine more alkaline and are therefore helpful in the increased excretion of substances in case of overdose or poisoning. Diuretics can either provoke or prevent certain hormones in the body to regulate urine production. Common medical conditions. The following contains information about some of the different medical conditions of the urinary system. Kidney infection. Medical term pyelonephritis. Type of urinary tract infection. Can occur in one or both kidneys. Usually caused by bacteria entering the urethra and traveling to the bladder and kidneys. Can cause infection to any part of the urinary tract. If not treated properly, it can cause permanent damage to the kidneys and may lead to chronic kidney disease. In rare cases, the bacteria causing the infection can spread into the bloodstream, which can lead to sepsis, a life-threatening condition. Causes for kidney infection include surgery on the urinary tract, bladder infections, long-term use of catheters, enlarged prostate and kidney stones. Symptoms can include pain during urination, frequent urination, groin pain, fever or chills, foul-smelling urine, pus or blood in urine, and/or inability to urinate. Kidney infections are usually treated with antibiotics or antibacterial drugs. The treatment medication should depend on the health of a person and the bacteria causing the infection, which can be identified through urine tests. Kidney disease. Kidney disease is the result of damage to the nephrons. Usually, the damage occurs in both kidneys and happens gradually over years. In the early stages, there are no obvious symptoms. The progress of the disease shows in the accumulation of fluid and wastes in the body. Once the kidneys fail or can't work efficiently to maintain life, a kidney transplant or undergoing dialysis is needed. Symptoms include loss of appetite, tissue swelling, itching, tiredness, nausea and vomiting, high blood pressure, drowsiness, difficulty urinating, and slash or darkening of the skin. A person might be at risk for kidney disease if conditions like high blood pressure, diabetes, heart disease, or kidney disease in family history are prominent. Diabetes and high blood pressure are the leading cause of kidney disease. Other causes may be glomerular disease and inherited and congenital kidney disease. Tests for the diagnosis of kidney disease include renal imaging and renal biopsy. Biopsy is a medical test that involves the removal of cells and/or tissues for examination. Treatment of kidney disease is generally focused on the underlying cause and can include blood pressure management, monitoring blood sugar, diabetes, and/or dietary and lifestyle changes. Glomerular disease. A condition that damages the glomerulus, plural form is glomeruli, a small structure within the kidney that helps to clean the blood of wastes by acting as a filtration. As the glomerulus or glomeruli become damaged, red blood cells and proteins can enter the urine. Proteins like albumin are important in taking out extra fluid from the body by acting as a sponge that draws the extra fluid into the bloodstream until the kidneys remove this extra fluid. If proteins like albumin enter the urine, blood is unable to absorb the excess fluid from the body, which results in the accumulation of fluid in the face, feet, hands, and/or ankles, leading to swelling. Glomerular diseases may also interfere with the secretion of waste products, which can result in waste buildup in the blood. Symptoms may include swelling in hands, face, feet, or ankles, foamy urine, blood in urine, reduced glomerular filtration rate, and/or low concentration of proteins in the blood. Causes can include infections, autoimmune diseases, when the body's immune system attacks the body itself, or sclerotic diseases, like diabetic nephropathy, glomerulosclerosis, and focal segmental glomerulosclerosis. Testing for glomerular disease can include testing samples of urine or blood, renal imaging, or kidney biopsy. Treatment depends on the cause of glomerular disease. When kidneys fail or can't work efficiently, dialysis or kidney transplant is needed. Kidney stones. One of the most common diseases of the urinary tract. Kidney stones are small hard substances developed from mineral salts and other waste products in the urine. Usually, these substances that make up kidney stones are dissolved in the urine. Once the urine is too concentrated with salts and other substances, crystals are formed. These crystals stick together to form kidney stones. As these stones pass through the narrow passages of the urinary tract, they cause severe pain. Causes for kidney stones include urinary tract infections, hyperparathyroidism, renal tubular acidosis, cystinuria, cystic kidney disease, or hyperoxaluria. There are different types of kidney stones: calcium stones, uric acid stones, struvite stones, and cystine stones. Certain factors may increase the risk for kidney stones, such as not enough fluid intake, family history of kidney stones, diet, limited physical activity, gender, age, and/or medications. A most common symptom is sudden pain, but other symptoms can include painful urinating, blood in urine, fever, chills, and/or nausea and vomiting. To diagnose kidney stones, blood and urine test can be done as well as X-rays and ultrasound. Treatment depends on the cause of kidney stones and can include extracorporeal shockwave lithotripsy, percutaneous nephrolithotomy, or ureteroscopic stone removal. Urinary retention. A condition where a person is unable to empty the bladder properly. Can be acute or chronic. Acute means the person is unable to urinate at all even if the bladder is full. Acute urinary retention needs immediate medical treatment. Chronic urinary retention may urinate more often and/or feel the urge to urinate. Chronic urinary retention may lead to future complications. Condition is caused by any health problem that causes an obstruction in the urinary tract and infection of the urinary tract, which can cause swelling of the tract. Other causes can include bladder stone, surgery, medications, multiple sclerosis, and diabetes. Symptoms depend much on the type of urinary retention. In acute urinary retention, symptoms include abdominal pain or discomfort, inability to urinate, or bloating in the lower belly. In chronic urinary retention, symptoms include mild abdominal pain, difficulty starting to urinate, weak flow of urine, and/or the urge to urinate again after doing so. Treatment depends on the type and the cause of urinary retention. Acute urinary retention might require catheterization. Chronic urinary retention may also require the insertion of a catheter. When using catheters, it is important to sterilize them. Sterilization is the process of complete destruction of all living microorganisms. Autoclaves are sometimes used to sterilize medical equipment and supplies, in order to prevent infections, such as urinary tract infections. Urinary incontinence. Urinary incontinence is the accidental leakage of urine, caused by problems with muscles and nerves that help hold or release urine. Urinary incontinence can happen to anyone, although it is more common in older people. Women are more likely to have problems with incontinence than men. This condition can often be cured or managed. There are different types of incontinence: stress incontinence, urge incontinence, overactive bladder, functional incontinence, and overflow incontinence. Causes for urinary incontinence include overactive or weak bladder muscles, diseases, like arthritis, damage in nerves that control the bladder, and/or the blockage from an enlarged prostate in men. Simple urine and blood tests can be taken to diagnose urinary incontinence. Ultrasound and cystoscopy can also be taken to diagnose urinary incontinence. Treatment depends on the cause and severity of incontinence as well as a person's lifestyle. Treatments include certain drugs, special devices to help control incontinence, surgery, or bladder control training. Cystitis. Cystitis is the medical term for bladder infection, a type of urinary tract infection. Commonly caused by bacteria. Often the bacteria travels from the urethra very fast and causes inflammation of the urethra, called urethritis. Sometimes the bacteria are not flushed out and travels up to the bladder and causing infection. Symptoms of cystitis include frequent urges to urinate, burning sensation when urinating, pain in the lower abdomen, dark or bloody and foul-smelling urine and/or fever or chills. Treatment is done by antibiotic therapy, but the antibiotics depend on the type of bacteria that caused the bladder infection. Fallen bladder. The medical term for the fallen bladder is a cystocele. It occurs when the wall between a woman's bladder and the vagina weakens, therefore allowing the bladder to bend into the vagina. This condition can be caused by a lot of straining, as in childbirth. It can also occur as women go through menopause. Cystocele is split into 3 levels: mild, severe, or advanced. Mild cystocele, grade 1, is where the bladder only bends a short way into the vagina. A mild cystocele may not cause any symptoms. Severe cystocele, grade 2, is where the bladder bends far enough to reach the vagina opening. Advanced cystocele, grade 3, is where the bladder bulges out of the vagina opening. Severe and advanced cystocele can cause symptoms as urine leakage while sneezing, coughing, or laughing, feeling of not emptying the bladder, and/or a bulge that may be seen at the vagina opening. Diagnosis can be done through either describing symptoms, physical examination, or imaging tests such as cystoarthrogram. Treatment is usually not needed for mild cystocele. In more severe cases of cystocele, a pessary, a device placed into the vagina to hold the bladder in place, or surgery might be recommended.